Healthcare is very much like aviation to a certain regard, where it's high risks, lives on the line every time, every day. To those ends, if we don't have all those safety mechanisms in place and we're not able to hit all those check marks along the road, we can introduce some risks to patient safety that are unintended. Michael Wissemann, last name is spelled Wissemann. I'm the nurse manager at University Health Services at Penn State. I served as an active duty Army Nurse Corps officer for 26 years. I'm a fellow in the American College of Healthcare Executives and a board certified nurse executive. To put that report in context, the report was put together in March and April of this year, which was a very chaotic time to be in the federal government, especially in the VA. As they looked at it over 130 facilities, they found shortages in 94% of those facilities regarding doctors and 79% of those facilities regarding nurses. Additionally, with psychiatrists and psychologists, they experienced shortages between 50 and 60%, which is really critical for the VA population. I wasn't necessarily all that surprised by it. The VA struggled for a long time with retention. Their compensation regarding docs and nurses, as far as financial compensation, just doesn't match up with the private sector, so they often struggle in that area. I think when we have low numbers of docs and nurses in those facilities, there's not less work, they just try to do more work in less time. And that can lead sometimes to taking shortcuts and the introduction of safety issues regarding patient safety. Yeah, I think the patients are pretty good about seeing the nurses work as hard as they can. They understand the compassion that they want to share. And the nurses really are trying to share that compassion too. But unfortunately, sometimes they don't get to all the tasks they want to throughout that day. I think the cause of the problem is a little multifactorial. We have a shortage of nurses across the United States. We're still short 100,000 nurses from the COVID pandemic. Over the 24 months, we lost nurses there. And there's just not enough clinical sites across the country to support the increase in nursing pipeline and creating more nurses. I think the VA struggles just like any organization. There's other organizations across central Pennsylvania and across the United States that just, I feel, do a better job with recruiting. Whether that be onboarding them, retaining them, checking in, making sure there's good preceptors assigned to them and keeping them in the pipeline. Many times when a nurse burns out, they go and look for somewhere else to work. And if the workload's too heavy at the VA or somewhere else, they may go looking elsewhere. Really, we have to look at how we do nurse training. There's several things that we can look at. Only about 50% work in hospitals. So do we really need all the clinical sites in hospitals, or should we be looking at outpatient as well to try to increase the capacity of nursing schools to get through the pipeline?
Well, let's see, where'd we go? The plan, do, study, act cycle is emphasized.
Commitment, that's always important, making sure everyone understands that. And define clear goals, right? SMART goals, we want something